Ladies and gentlemen, welcome back to another fabulous episode of the Healthcare Trailblazers Podcast. I am excited, very excited to be sitting here today with the wonderful Dr. Eyal Zimlichman. Dr. Zimlichman is the Chief Transformation Officer and CIO at Sheba Medical Center and the Director and Founder of the ARC Innovation Center. I have heard a ton about Dr. Zimlichman over the last 2-3 years. We've spoken with multiple companies that have been related to your kind of innovation center. So excited to be speaking with you today. Doctor, thank you for taking the time.
Of course. Thank you, Mendel, for having me.
Absolutely. So let's dig right into, for me, what's the most fascinating piece for me, which is everybody knows that there's a ton of innovation that comes out of Israel when it comes to technology. And in recent years, I've got a friend, Sally Frank. I don't know if you know Sally from the Microsoft Startups Program. Okay. So she's wonderful and she's putting out a new book. And she asked me to look over the manuscript and I got to read a lot of it. And some of the companies she's interviewed are Israeli companies, and they talk about how maybe a couple years ago, maybe 10, 15 years ago, it wasn't a thing. The health tech market was not a thing. It's in Israel and it's kind of a recent phenomenon. But since then, there's been a ton of health tech innovation coming out of Israel. And what I hear from so many folks is that there's this fascinating partnership between the health entities and the health systems in Israel and the startups and the innovation. And I think you, sir, are at the core of all of that, marrying these two interesting worlds. And I'd love to kind of dig in and hear about how it started and hear about how it's going, because I think in the US, there's kind of this sense that might be changing now with the new administration, but there's a sense that, like, if you're government, you can't bless any private companies or work with any private companies, because then you're kind of, you're messing with the free market and stuff like that. And so therefore, it's, first of all, extremely cumbersome to work with the government. It's very difficult to work with the government. And you seem to have this very interesting model that seems to be working. So I know that was more of a ramble than a question, but Doctor, how did you go about starting the Innovation Center?
So just to say a few words about Sheba Medical Center, for those of you less familiar with it. So Sheba is the largest hospital in Israel. It's also considered large by any standard. It's largest in the Middle East. It's about 2,000 beds all on one campus, which is very unusual. Specifically in the US, you don't see these large organizations that are sitting as a small city by all accords. It's ranked as one of the top 10 in the world for the last 6 years since Newsweek started ranking hospitals on a global list. On our last 2025 ranking, we came up number 8 in the world. And of course, we're very proud about that achievement. And Sheba was always leading in terms of research and innovation. We always were spinning out startup companies. We saw that as some of the core values that Sheba provides. Just like we're doing research, we're also doing commercialization and we're spinning out companies, but it was on a much lower scale. In 2017, I was asked by our new CEO, Professor Yitzhak Kreis, I was the chief medical officer at the time, to set up an innovation platform. We didn't want to just put together the regular, typical innovation center that many academic medical centers are doing around the world, especially in the US, but we want to do something different. We set different goals. We decided, number one, that innovation needs to serve transformation of the healthcare industry. We need to change and solve the existential threats that healthcare is facing. And hospitals around the US are facing these challenges just as well. Financial sustainability. We know healthcare is becoming more and more of an issue to try and run a ship that actually doesn't lose money at the end of the year. The costs are going up, the reimbursements are going down. It's more and more of a challenge. We have workforce crisis. We have shortage of nurses, shortage of doctors, many other professions. How do we solve that? We have a huge gap in quality and patient safety. We haven't been able to solve over the past 30, 40 years since we know about this. So we wanted innovation to really be able to address these critical issues, not just innovation for the sake of innovation or even innovation for the sake of making money, but innovation really to transform the healthcare industry. That's what we set out to do. And then the second goal we set on top of the first one was to say, we'll be missing on a huge opportunity if we don't turn innovation into an economic engine of growth. So we wanted to reach, one, healthcare transformation, and two, drive the economy forward, both in terms of turning the hospitals into a profit center rather than a cost center, as well as having an impact on society around us by creating jobs, by bringing in foreign investment, by bringing in large industry to set up shop in our local environment. And all of that has been, from the get-go, our goal. And we were able to really build on top of this to turn the hospital and then other hospitals later on into factories of innovation. We grew from starting 2 companies in 2017 when we started working on this to starting 20 companies in 2024, all based on IP developed at Sheba Medical Center by our own clinicians and researchers addressing real-world problems. 70% of those are in the digital health space. The other are split between medical device and pharma, but digital is mainly where we're focused at. And these are companies that over the last 5 years, since we officially launched ARC in 2019, have grown by $5.8 billion. This is the growth of valuation of companies that came out of Sheba in that span of 5 years.
And you're creating them from scratch, or are these external companies that the startups that come to you and partner?
So these 20 that I mentioned, that growth from 2 to 20 are all companies we created from scratch. We have developed the IP. We spin out the companies. We hired the team to run the company. You need a CEO for every company, obviously. You need a CTO and so on. And we raised money, $2 to $3 million on average for each one of those, multiplied times 20. That's what we're doing every year. We had to build a whole system into place to be able to support this factory of innovation. On top of these companies that have come from within Sheba, we have an open innovation arm, which are companies typically in early phase that come to us and want to be part of the ARC global ecosystem because they want access to data, access to clinicians, access to patients, and access to the global market, especially the US market, which is obviously the primary market for many of these startup companies. So we provide them all of this, and we bring them into ARC in exchange for a little bit of equity. That's our financial model. And then on top of the organic innovation companies that have come from within Sheba, we have a similar amount of open innovation companies that join ARC on a year-to-year basis. And altogether, we have 120 startup companies at ARC today that, some of them are very early stage, but some of them are already unicorn companies worth over $1 billion.
Incredible. It's so interesting that it's a very common theme, and it makes sense because the population in Israel is not the population in the US. But a lot of these companies, they're kind of born in Israel, but they build for the US, and they kind of start there, and then they come out for this market. What are some of the similarities and what are some of the differences in the actual patients across the two? Because when you're building a health tech, you're building it for, at the end of the day, a lot of these are for the end user, which is the patient, or will affect that patient, even if it's for staff or, administrative function, things like that. Do you find any differences or any similarities that kind of stand out to you that are interesting?
Well, first of all, the one thing I have to say, which was an eye-opener for me and from our team, is that, although healthcare systems are very different, we speak a lot about the difference between the U.S. healthcare system versus the U.K. healthcare system with NHS and everything, the similarities and differences between the U.S. and other healthcare systems around the world. And we think that because they're so different, specifically the U.S. healthcare system, and I think you all know, we look at from afar at the U.S. healthcare system and are quite at awe with the complexities and so on of the system itself. But as you look, and I'm saying this, of course, cautious that I won't say anything that I'll regret later. But when you look at hospitals and when you look at healthcare operations, at the end of the day, they're extremely similar. The patient coming into the emergency department in the US, in Israel, in the UK, and in Germany face the same problem. They all wait too long. And they all wait too long for the same reasons. The fact that hospitals are so inefficient in managing a patient flow, if we were learning 10% of what airports have learned to manage traffic, just 10%, we would have saved millions and millions of dollars and would have been much more patient-centric than we are today. Patients coming to the hospital, they get lost. We haven't figured out how to make sure that they know where they're going. We were very poor at managing patient flow out of the ED, into the ED, and so on. So once you realize that at the core, at the production floors of healthcare, the problems are extremely similar. When we come out with out of Sheba, when we come out with a solution to a problem we face, it has a huge market in the US, in the UK, and in Germany. And this is something that I think most have not figured out. We typically look at the differences, but we should look at the commonalities. And there's a lot of examples, and you've met some of these companies that have solutions that, I'll mention one, our poster child in many ways is a company called AI Doc or ADoc.
Yep, they're in the book.
Right? They came out of Sheba in 2017. Their first company that came out of ARC. The company now is installed in 1,600 hospitals across the world. Huge uptake. And they were developed at Sheba. We were the ones to make a decision to focus their solution in the emergency department together with the company, understanding that the ED is a place where they could enjoy the most this kind of solution for CT scans for emergency situations like stroke, pulmonary emboli, and other conditions. I would say unsurprisingly, the same solution is needed in the US and the same solution is needed in the UK. And I always say, if my parents were living in a small village somewhere, I would want their ED to have such a solution because it really has an impact on outcomes of patients coming into the ED.
Yeah. Yeah, it's my eyes lit up when you said about airports, because I've recently been on this bit of a tangent comparing the healthcare system to the airlines, but in a bit of a different angle than you took, which I think is obviously a very, very correct point. I believe that the biggest issue with ER and even regular doctor visits is not actually the wait time. It's the lack of communication about said wait time. And you have no idea if you're going to be sitting there for 12 hours or 2 hours or 30 minutes. You have no clue. And you, God forbid, make the mistake of getting up and going over to the lady at the front desk and asking her, you're going to get such a look and be told to sit down and be quiet and, and keep staring at the people that are being wheeled in. And it's the reason why I compare it to the airlines is because I've noticed a massive, massive increase in efficiency around communication with airlines, where I'm talking about literally in the last 5 years. I'm not talking about, 15, 20 years. Literally in the last few years, you see where it used to be very similar frustrations, where you had no idea if your thing was getting delayed. And now the notifications that they have on the phone are so good. You literally, I've seen recently that you'll get a notification, hey, we're waiting 5 more minutes because there's a plane coming from X and we're waiting for 2 passengers. To get that level of notification it makes the experience so much better. And so I could pull out my phone, and it's what I think is most interesting about it is that I don't think the delays have gotten better, but the communication has gotten so much better that I think it's improved, that experience so much. And so I don't know if there's anyone working on that. I'd love to hear from you if you know of anybody, but yeah, what do you think about that?
Yeah, the concept that we're promoting, and we're not the only ones, but we are very, very focused on building patient flows that are controlled from a central place, like an airport. We call them command centers.
Mm-hmm.
We have our clinical command center at Sheba, which is using a lot of analytic tools to optimize patient flow, and through this process to make sure patients are aware of what's going to happen. I'll give you another example, not related to the ED, but part of hospital operations. If you're going to have a patient who's hospitalized on one of the units, and you want that patient to do a CT scan, typically that patient has no idea when he's going down to do the CT scan. He's waiting, at some point somebody's going to come and pick him up and take him to the CT scan. And then he's probably going to wait another 30 minutes to an hour down at radiology before the CT room is available. So we're building this in a fashion that allows us to know exactly the second the room will be available, because we can project how long the previous scan is going to take. And we send a person to bring down the patient at exactly the same moment where the room is going to be available for the CT scan. So we know much better when the patient is going to go down. We can tell them, listen, at 3:30 p.m., you're going to go down to the CT. And if there's a delay, we will let them know that there's a delay. So we do this through, we have a system. Every patient, it's not completely around the entire hospital. We're spreading this out. It's about 30% of our beds currently, where the patients have a tablet, and the tablet provides them with their own schedule for the day.
Mm-hmm.
So at what time they do, what test, so they can be ready for that. So if family members are coming and they want to go down and grab a coffee at that cafeteria, maybe I shouldn't go because at 3:30 I have a CT scan I have to take. And
what about just text to their phone?
So We know some people don't have phones, and in Israel specifically, we have issues with ultra-Orthodox Jews that are not using smartphones. And
They're
we
not
want to
going to
make
listen
sure,
anyway. So
yeah, no, they will use it because it's only being used for scheduling, and so the rabbis will approve. But the idea is that from health equity perspective, we want to make sure that everybody has access to it. They can still also access it from the phone as well.
Mhm.
But
Oh,
there's
okay.
a tablet there that provides them with the best user interface and so on.
Got it. Kind of pivoting a little bit, but I feel like there's so much. I've had many episodes of talk. I think one of them is even called "HIPAA's a scam." Is like that. But I've had so much conversation about I have this belief that kind of HIPAA was sold to the public as this like amazing thing that's going to protect you and it's going to make sure that everything's safe. And instead, it hasn't protected people 100% because the data leaks still happen all the time. And on the flip side, it's caused so much convolution and so much difficulty in just regular communication. And the thing that I always come back to is like, and it's like, I don't care. I also think there's been a massive generational shift in the way that we view our sensitive information. And I think that our generation is 100% not just used to, but interested in trading convenience for security. We do that with our credit cards. We do that with all our other information. And I feel like I don't care about my health data any more than I care about my private messages. And yet, I can pull out my phone and send a fully encrypted WhatsApp or Signal or whatever message with no hindrance, but to communicate in healthcare is impossible. Do you guys have similar levels of like, do you have a version of HIPAA in Israel, and how do you deal with that?
Yeah, it's very, very similar. We're actually, regulations in Israel follow pretty much the regulations in the US. The European regulation is even tighter. So if you feel that's slowing down some of the innovation, then in Europe it's even worse in many levels. But I agree with you completely. I think that there's we tend to think of healthcare data as the last thing we can take risk on. But a couple of years ago, when I would tell you, listen, you could give orders to your bank on transfer of money electronically, and you can view all the data on your smartphone, people will say, I won't let anybody deal with my money, right? That my money is the most sensitive issue, and anything that puts my money in risk, I wouldn't want to have any part of it. I'm willing to go down to the corner of the street and do this manually.
Right.
We're at a situation where, if it takes us more than 3 clicks on our app to do something on our bank, it's just bad UI, right? I mean, it needs to take us less than 3 clicks. Well, in healthcare, we're way behind it. And I think much of that has been because of regulation, as you're saying. And regulation has really stagnated much of this field. However, the technology exists. It's not much different than technology used in banking, just different purposes. And we are seeing advances. When I look into the future, and I talk a lot about what the vision of the future of health would look like, and what would we, I typically say that I think that 10 years from now, if you'll need to see a doctor or a nurse or whatever, and people will tell you, listen, you need to come to the clinic, it'll be just as frustrating for us as today somebody needs to tell you, listen, you have to come in physically to the bank. When people tell us we have to come in physically to the bank, we're mad. We're going to take time out of our day. We're going to look for parking. We're going to stand in traffic. And, this is not 21st century.
Right.
While in healthcare today, it's still the case. You still would go into your car. You still would drive, even for, a simple appointment. I think that transition will happen over the next 10 years. And I think artificial intelligence specifically on top of that will provide us access to clinical information at any point in time we'll need it. If it's in the middle of the night, if we have a question on how many Tylenol pills I can take for my pain, today, good luck with trying to find an answer to that in the middle of the night. But 2-3 years from now, you'll have an AI agent that will know your medical record exactly and will tell you that kind of information at any point in time during the day.
Yeah.
So these are the kind of transformations we're likely to see very, very quickly.
Yeah. So let's kind of double click on the whole AI thing, because you mentioned right before we started recording that you've built the largest AI center in a hospital. What were you saying?
So I told you the story. A government hospital doesn't get to hire 60 to 80 new FTEs, new positions of top talent in artificial intelligence, paying competitive salaries to Microsoft and Google. It just doesn't happen in any hospital, let alone a government hospital.
Mm-hmm.
The way we were able to do this is through exits of two of our companies during this past summer. They actually came in 2 weeks after one another. I like to joke and say these are typical 2 weeks for ARC, but maybe at one time we'll have an exit every 2 weeks. But we did have these two exits that brought back substantial funding back into ARC and into Sheba, and we made a strategic decision to reinvest $60 million out of those earnings into setting up a new artificial intelligence center. And we're now in the process. We're halfway through hiring the team. We hired a CEO for the AI center, a woman who has incredible talent from multiple industries, including autonomous vehicles. We want to bring that into healthcare. And she's in the process of really bringing top-notch, top of the line Microsoft, Google, Amazon folks to work at the AI center at ARC at Sheba. So this is going to change how hospitals would look like. The aim of the AI center is to turn Sheba into an AI-based hospital by the year 2030 as a model for the world of what AI can accomplish at hospitals. How can we rethink completely what hospitals look like with the use of AI? And then we're building a new hospital right now that's going to open its gates in 2031 in the south of the country. And that new hospital is going to be AI-based from day one when it starts. So this AI center is doing this, by the way, not just through developing solutions. We're developing quite a bit with some of our partners like Microsoft and others, but we're also looking to buy the best technologies out there. So out of the $60 million, we've placed a nice sum to the side to just buy the best technology on the shelf, and what's ready for implementation we'll implement. We think a critical issue is implementation. How do you get the staff to use? How do you build this into the workflows in a way that won't create more work for the staff, because it wouldn't work if you're adding to the overstretched clinical teams already. And that's a cornerstone of what these AI center is looking to achieve.
What are some examples? When you say an AI first hospital, my mind goes everywhere. What are some concrete examples that you think would be transformational? Because it's so difficult to rewrite the script, right? It's difficult when you're erasing a chalkboard and then you're trying to write on it. It's always messy. But when you're starting fresh, there's so much more that you can do.
Exactly.
And what's really difficult about what you're doing is that, well, really cool and exciting and exhilarating about even thinking about it is that it's not just technology, but the technology can probably inform, it's the entire experience from A to Z. I'd have to imagine you're rethinking where rooms are and how rooms are and where things are and waiting rooms and parking areas and like everything from A to Z. To be able to like rethink that is probably massive. But yeah, what are some exciting like states of future that you think you'll actually have implemented in the new hospital specifically?
So I could tell you something we already started, and it's already in use with real patients. This is not just theoretical. We are establishing an AI-based emergency department.
Okay.
With the idea, we spoke about EDs before, with the idea that you come into the ED, you'll be triaged by an AI. The AI will take your full history, will determine what kind of tests you need to do in the ED, right? If you need to take a blood test or chest X-ray or CT scan of the head or whatever, the AI will determine that. You go on, you do the tests. Once all the results are in, you come back and you sit down in front of the AI. There's a human avatar, and the human avatar would go through what the tests have revealed, what's the diagnosis, and what's our suggestions for your future care and follow-up. All of this end-to-end is AI. This is working right now at Sheba Medical Center on real patients. Only one caveat, because it sounds science fiction. One caveat is, on the back end of this, we have a human physician. And the human physician acknowledges and approves the AI's decisions on any part of this journey. So the patient will not go to do a CT scan unless the physician says yes and ticks the box. So it is recommendations for the doctor. The doctor goes on and acknowledges those, and then it goes on to the patient. This is how we see the future. But with time, we'll have more confidence to take away the human, to take away the doctor. And a lot of these cases, as we look in 2030 and 2031, when this new hospital would launch, the simple cases will go through AI end to end. And we'll just need the emergency doctor at the end of this to sign the discharge letter, because obviously the AI will need to be regulated to be able to do this on its own. And that's regulation, which obviously is not up to us. But if need to, then the ED doctor will just sign the letter at the end after, of course, it acknowledges everything and looks to see that the AI missed nothing on what the patient went through. So this is an example which will solve a lot of issues, right? We spoke about the waiting times. We spoke about the fact that it's a big unknown. We don't know how long we're going to wait. We don't know what's the next step. If a car accident comes in or major trauma, that delays everything, but we don't know about it, right? We're sort of left on the side. All of that, the management of the ED will be on a totally different level. So that's just one example.
So many follow-up questions. You talk about how technology is gonna get better and better at replacing the doctor, and I think it's not, a lot of people look at that as a negative thing, but it's not really replacing the doctor. It's the fact that there are no doctors. There are no doctors anymore. Everyone is running out of staff. So we need to augment the staff. There's no question about it. And then you can essentially upskill even doctors, where now instead of just being able to accomplish X, you could accomplish 100X. Where do you think, so right now, 2 years ago, all the rage was just AI, and now it's agents, right? All the rage is agents right now. I've got my opinions on the matter. Where do you think the actual current state of agentic AI is for healthcare specifically? And where is it positive and where is it irrelevant?
Well, we're very, very early stage. We have to remember, 2.5 years ago, generative AI came into our life, right? Before this, when we said AI, we meant machine learning. Now, when we say AI, we mean something totally different.
Right.
It's expanding and developing so quickly that, right now in the US, 25% of hospitals, if not more, are already using ambient listening to capture the conversation between the doctor and the patient, summarize it, and enter it into the ED. And basically, we can take out the keyboard from the patient room. Now, what does that do? If we take just that example, what does that do to the physician-patient interaction? There's much more eye contact. There's much more time to spend with the patient. There's much more time to explain to him exactly what he wants to know and answer all of his questions, or place a hand on his shoulder and just give a gesture of empathy. All of that was missing when we didn't have this kind of tool. And this is sort of the basic, simple thing that already exists. As we think about agents and we think about conversational AI and really the ability to augment doctors by taking away some of the tasks that AI could do better, but leave within doctors what doctors can still do better.
Mm-hmm.
This is the way that balance will be built over the next couple of years. We deal a lot within our AI center in what we call human task optimization. Human task optimization is relevant for doctors, nurses, administrative professionals, physiotherapists, pharmacists, everyone. Probably you and I in whatever we do on our day-to-day work, right? And how do we take away some of our tasks that the AI can do better? And that, of course, will change with time. We have to be agile enough to adapt. But take that away already and free the human to do what the human can do better. And people ask me, what's going to be the doctor of the future? What's that going to look like? And I have one answer that when I give a talk about the future of health, I like to end with because it's a positive note. And I say, I don't know exactly what's that going to look like, but I can say one thing for sure. The doctor of the future will be much more humane and empathic than the doctor of the present, because that's the only thing that will differentiate him from the AI. And if we're not that, then there's really no point for having human doctors. So the evolution of the physician will be towards these soft areas of empathy, of human attention, and humanity. And that's, of course, is good news, I think, for everyone.
I agree so much with your point about empathy being exclusive to humans. It's funny. I feel like, in startups, everyone's looking for these new startups that you can accomplish. Like, we're doing this and a lot of people are doing this where with 5 people, you can accomplish the work of 50. And that's like one of these where it used to be like, oh, you're a small team. We're not going to look at you. Now it's like, oh, wait a second. You're a small team that's doing all of this. Wow. You must be using a lot of AI. That must be really cool. So I feel like one of the cool metrics that you can kind of track is maybe trying to do that in healthcare, where like a whole hospital that's run by 15 people. But you have one doctor, one surgeon, one this, one whatever, and you run a whole hospital and you're seeing thousands of patients.
So I can tell you, we have a project called Project F. F stands for future. And Project F is about designing the inpatient unit of the future. We are building it for 32 beds with 2 physicians. And today, 32 beds would have about 6 physicians. But this is how we're building it. We're putting in all the support that's needed. Of course, much of it is AI-based. But we're doing a lot of work with teamwork, for example. What's going to be the role of other team members, right? I mean, working at the top of the license, making sure that doctors do only things that doctors have to do and that nobody else can do. Otherwise, you could offset that to other professions. So by redesigning the workflows, and we're doing a lot of work around this, we are going to move to a space where the unit of the future will only need 2 physicians, and they would have a lot more time to spend with the patient than the current 6 physicians in the same size of a unit.
Yeah. So talking about the regulation for a moment, do you inform the Israeli government's, because like it seems like the perfect balance where on the one hand, it's a government funded healthcare system. And on the flip side, you've got all this innovation. Like you should be the perfect person or the perfect, to really be that sweet spot of informing what regulation should look like. Are you involved at all?
We are more and more with time. The regulation in Israel specifically, very similar to other countries. We have our own, sort of FDA approvals and our own questions around AI and what kind of regulation AI algorithms would require. So it's very, very similar. We're struggling with some of the same questions as does the FDA in the US. And we are helping out because we're so advanced in what we're doing. We're sort of setting the pace for everybody else. So some of the issues like the ED I mentioned, the AI-based ED and others, we're now conducting what I mentioned before under IRB, under ethical approval. And patients, of course, need to sign that they approve to be part of this program. But as we move forward and we draw more and more experience with this, we're working hand in hand with the Ministry of Health and with the regulatory bodies within the Ministry of Health to make sure that the regulation would support it. So right now, very similar to the US, the AI regulation is still not complete. It requires a lot more to really be able to allow us, on one hand, to keep patients safe, which we all are looking to do, and on the other hand, not stifle innovation so we can leap forward in the way that healthcare deserves.
Yeah, because I feel like here you have 2 separate people or 2 separate entities with 2 separate incentive structures, and essentially the government or any kind of regulatory body is going to be heavily skewed and biased towards safety and patient, privacy and stuff like that, and the kind of enterprises are skewed towards just profitability, which means let's just put out products. Let's see how it goes. I think it's very unique to kind of sit in both areas and have the incentives on both sides. That's got to be really interesting.
Yeah, well, Israel is a small country and everybody knows everybody. And so that's an advantage when you're building something like this. We used this advantage in the past as well. We have national medical records that started in 2004 and have become, 100% of providers and patients in the country that are on the system by 2016. So for the last 9 years, we have complete 100% national records where I could see if a patient comes into my ED and I've never laid eyes on this patient in the past, on the computer, I get to see his entire medical history, regardless of who was treating him in the country.
Are there any other countries that have that?
Some little fractions of that, Estonia and some other countries that have started establishing this over the last couple of years. Nobody has that 9-year experience, of course, that we have. Israel seems like a small country, but it's 10 million, and it's larger than some European countries that have struggled and have not been able to mobilize something like this. It has a huge impact on quality and patient safety. Having access to the entire information, and it saves costs. You're not going to redo CT scans, because if the patient has done it last week, you have the results right then and there at your fingertips. So it saves a lot of spending.
Well, it's probably not just duplicative procedures and services, but it's also, when you talk about looking at data and trends and risk bearing, the ability to take risk, you have one data system that's the best. That's the best thing ever. In the US, you have essentially every ACO is their own little data system. And then on top of that, you have all the EMRs, and then you have this, that, and the other. It's so disjointed. Everyone's running their own risk models. And then, it's really difficult for payer A to really take risk on here, because they don't have the data from there. That seems to me to be the biggest. I feel like we almost, buried the lead here. That seems to me the key to success for what you're doing.
Right. In Israel, it has long standing. I mean, Sheba Medical Center has been completely paperless since 2004. So we've, integrated the last department here to integrate the records was the emergency department. Typically, it's the last one. It's very complex. But we've been completely paperless. We have huge amounts of data going back all these years. And we've invested quite a bit in the quality of the data, because, as you know, that's critical. It's not just about, the volume, but also the quality. And right now, we're working with many partners also around the world. We have a huge project together with Mayo Clinic and some other partners, basically to share this data from leading institutions around the world for scientific discoveries, for AI development and AI validation, real world evidence. You imagine if we had this during COVID, when we wanted to learn from one another on, how effective were the vaccines, for example, or some of the medications that were given. So
right. Instead, we had
very
Twitter.
short while. Yeah, we all know the case of Israel in that regard. And for the past couple of years, just after the pandemic, we've made huge strides in that field, which of course, we will hopefully, we won't put it to use for another pandemic, but if we need to, I think will be very, very advantageous.
Wow. Well, doctor, your reputation definitely precedes you, and I see why. You speak with a spark in your eye and a very clear energy around innovation, and it's quite exciting to speak with you. I think you're one of some people that could talk about the future and the way that things look, and then some people it kind of just exudes, and you can kind of really feel it and picture it. And so this has been really wonderful, and really excited to see all the incredible things that you have planned.
Thank you. I enjoyed the conversation very much, Mendel. Thank you very much.
Thank you.